Now let's talk about some variable types. So one way we can classify variables is as dependent or independent. Dependent variables are the event or outcome we're looking to explain by the influence of the other variables we're studying. So it depends on the effect of other variables. The independent variable is the characteristic or characteristics being measured or observed that is hypothesized to influence the event or outcome. So it's the influencer. It's not influenced by the event or outcome, but may cause or contribute to it. Some other ways to think about IVs and DVs. An IV would be the characteristic being measured, observed, or hypothesized to cause, influence, or contribute to variation or development of an event or outcome in the DV. So this could be treatment, gender, exposure to different materials. And some different terms for IV are also exposure and treatment condition. The independent variable is stable and unaffected by other variables you're trying to measure. So it refers to the condition of an experiment that's systematically manipulated by the investigator. It's the presumed cause of the change in the DV. The dependent variable is the event or outcome whose variation we want to explain or account for from the independent variable. So this could be a self-reported quality of life, type 2 diabetes, or mortality. It's also known as an outcome or disease health status. This variable depends on other factors that are being measured, and they're expected to change as a result of an experimental manipulation of the independent variables. So it's the presumed effect. Some ways that might help you remember independent versus dependent variables are using the sentence. The independent variable causes a change in the dependent variable, and it is not possible that the dependent variable could cause a change in the independent variable. So if you insert the names of the variables you're using into this sentence, where I said independent variable and dependent variable, you'll want to insert them so that the sentence makes the most sense. So this will help you identify which type of variable it is. So I have a few examples on the next slides to help practice this. So for the first example, a scientist wants to study the impact of a new chemo drug on decreasing bladder cancer severity. What are the independent and dependent variables? Well, the independent variable is administration of the drug. So was it administered? Yes or no? And then the dependent variable is cancer status. So did it improve or did it not improve? Example 2. Is there a statistically significant difference in graduation rates of at-risk high school seniors who participate in an intensive study program as opposed to those seniors who do not participate in this program? Here again, you want to identify the IV and DV. Well, the IV is participation in the intensive study program. Did they participate? Yes or no? And then the dependent variable is graduation status. Did they graduate or not? And a third example. A director of residential living on a large university campus is concerned about the large turnover rate in resident assistants. In recent years, many resident assistants have left their positions before completing even 1 year in their assignments. The director wants to identify the factors that predict commitment as a resident assistant, defined as continuing in this position for a minimum of 2 years. The director decides to assess knowledge of the position, attitude towards residential policies, and ability to handle conflicts as predictors for commitment to the position. So this is a longer example, but I still would like you to identify the IV and DV. The IV is knowledge of the position, as well as attitude towards policies and ability to handle conflicts. So there's actually 3 independent variables here. The DV is commitment to the position. So did they continue in the position for 2 years or did they not? Next, I'll talk a little bit about confounding. So a confounding variable occurs when there's 2 factors that are associated with each other, and the effect of one is confused or distorted by the effect of the other. So there's a 3-part definition that you want to use to determine if it is a confounder. So a variable has to be associated with the exposure, it has to be an independent risk factor of the disease, and it has to not be in the causal pathway between the exposure and the disease. So it has to have all 3 of those parts to be a confounder.